Hello, I'm Cheryl Toole, Nursing Director in the Neonatal Intensive Care Unit at Boston Children's Hospital. Today, I'll be speaking with Dr. Michele DeGrazia, Neonatal Nurse Practitioner and Nurse Scientist in the NICU at Boston Children's. Michele will be speaking today with us about her research in Deformational Plagiocephaly, also referred to as DP, and a first-of-its-kind device to treat and/or prevent infants with this deformational cranial asymmetry. Hi, Michele.
Hey, Cheryl.
Can we just start with telling us a little bit about what deformational plagiocephaly, also referred to as DP, is?
Deformational plagiocephaly is a flattening of the baby's cranium. Infants develop deformational plagiocephaly as they spend long periods of time in bed. What happens is the suture lines of the skull are not fused, and the skull is actually mobile, so the head takes the shape of the bed when babies are exposed to a flat surface for long periods of time, or if you have some other type of object that the baby's head is exposed to, sometimes they will take an irregular shape depending on how the baby's positioned.
Are there different types of deformational plagiocephaly?
Yeah, so there's three main forms of deformational plagiocephaly. There's an overall term called plagiocephaly that refers to an irregularity of the head shape itself. So that's kind of a broad term that's used for the condition. And within that term, there are other types of or forms of deformational plagiocephaly that have been identified in the literature. So the preemie babies can develop something called dococephaly, which is flattening on both sides of the head or one side, and the head becomes elongated in shape. Brachycephaly is the kind that's seen more commonly in full-term babies, where the back of the head is completely flat, and those are generally the babies that are put on their backs to sleep all the time. Now very common because of the back to sleep recommendation by the American Academy of Pediatrics. And then other babies will develop something called scaphocephaly, where the head is narrow towards the top but more wide down below. And it's almost like a triangular or egg shape that you see. And those are the most common forms of plagiocephaly that we see.
We'd like to pause for a moment and ask those listening if you could tell us what city and country you're listening from, and also if you have infants with deformational plagiocephaly, any of the types that Dr. DeGrazia described, and do you have any creative or innovative strategies that you use to prevent or treat this? What led you to your research on DP?
So my research took an interesting turn a while back. My original research was on car seat safety for preterm babies. And when I was looking at investigating infant exposure to the car seat, prolonged exposure, because we know now that parents have these portable car seats for their babies, they tend to take their baby everywhere in the car seat. Not just for the car anymore. So what we were concerned about is whether or not these infants that are spending long periods of time in their car seat are having any kind of developmental problems as a result of that. So what I was going to do is study babies who spent long periods of time in their car seats and just look at different characteristics such as tone, strength. And one of the characteristics I was going to look at was actually head shape. So I went to see a doctor named Gary Rogers. He's a craniofacial surgeon. And I wanted to learn about how to do head shape measures for this particular study that I was going to do. Dr. Rogers, during that visit, introduced me to a device called the PlagioCradle. And he told me that he was having success at correcting some mild forms of plagiocephaly in babies that were coming into his outpatient clinic. When I saw the device, I said to Dr. Rogers, we need to use that in the NICU. Dr. Rogers introduced me to Boston Brace. I began working with the folks at Boston Brace to downsize the PlagioCradle that he was using in the outpatient clinic with full-term babies to make it more compatible with preterm babies and smaller infants, the sick ones we see in the NICU. Mm-hmm. So I worked with them. We went to several NICUs, visiting several NICUs, and tested different versions of the device inside the baby's isolettes and cribs and other sleeping surfaces that NICUs use. In addition, we added padding and a felt liner underneath a cover that would keep all the layers in place. And eventually we were happy and satisfied with the device we came up with, and that's when I started testing it in the NICU with babies, doing a randomized control trial.
So Michele, can you describe the PlagioCradle a little bit more?
The PlagioCradle is a device made of a solid plastic base that then has several layers of foam. The foam is molded to the baby's shape and helps to support development of a normalized head shape. As the baby grows, we remove layers of foam so the cranial cup actually grows along with the baby. When babies are in the NICU, we use the PlagioCradle on the baby's bed, and what we end up doing is trying to use it for at least 12 hours a day so that the babies get the most benefit from the device. We're trying to avoid them for spending long periods of time on the flat bedding.
So ultimately, who came up with the idea for the PlagioCradle?
So the PlagioCradle was developed here at Boston Children's Hospital by Dr. Gary Rogers and James Miller, a licensed orthotist. They came up with this idea in response to the increasing amount of children they were seeing in the outpatient clinic that were presenting with plagiocephaly. This was becoming more prevalent as a result of the back to sleep recommendations by the American Academy of Pediatrics. So together they developed this device and started using it in the outpatient clinic. And Dr. Rogers was having good results in using this in the outpatient clinic with babies who basically had mild forms of plagiocephaly. In doing so, he was able to prevent the babies from having to wear helmets.
Michele, are there any clinical conditions that prohibit the use of the PlagioCradle?
So that's a good question. Because babies have to be positioned either supine or semi-side-lying on the PlagioCradle, babies who have airway problems or only can be positioned prone cannot use the device. The other limiting factor to using the PlagioCradle is that babies that are under 1 kilo are not eligible to use the device. The device starts out at 1 kilo, and the preemie version, there's 2 versions of it. The preemie version goes up to about 2.5 kilos, and then the full-term size one starts at 2.5, and basically can be used until the child starts to roll over at about 4 months of age.
How much time does the infant spend in the PlagioCradle, and are there any restrictions on the maximum amount of time they can spend in the PlagioCradle?
So we like babies to spend a minimum of 12 hours a day in the PlagioCradle. We encourage the nurses to position the baby on the cradle whenever they're in bed, with spending some time on their bellies to develop those muscles and, develop their strength. But the remainder of the day, they can be on the PlagioCradle.
So I know you mentioned that you would like the babies to spend a minimum of 12 hours in the cradle in a 24-hour period. Is there a maximum amount of time or too much time that they can spend in the cradle?
So we like babies to spend, as I said, a minimum of 12 hours. We want babies to develop properly, so we like them to be repositioned frequently, and we'd like them to be positioned in all different positions. So we do like babies to spend some time during the day prone, on their sides, as well as supine. So really it depends on the baby and their clinical condition, and we usually leave it up to the nurse's judgment to make that decision in terms of what's enough time for any individual baby.
So Michele, as a neonatal nurse practitioner as well as a nurse scientist with an expertise in neonates, we obviously both know that developmental care is so important in the NICU. How is this accomplished by using the PlagioCradle?
So that was something we spent a lot of time thinking about, because we definitely wanted it to be something that we could provide developmental care with. What we did in the research in the study that I did was we positioned babies on the PlagioCradle either supine or semi-sideline. And then we had a device, a long beanbag-like device, that we were able to make a boundary or a nest around each baby with. In addition to that boundary, we were able to take straps and bring them up around that, attached with Velcro, around the baby and the beanbag-like device to secure the limbs and provide containment for the baby.
Swaddle the infant in a single soft blanket. Position the infant on the PlagioCradle using the bed buddy or other boundary device. The infant can be positioned supine or semi-sideline, but never prone. Use the containment straps to secure the infant on the PlagioCradle device. The containment straps are adjustable by way of Velcro located at the end of each strap.
I'd like to pause for another moment to ask those listening if you see any challenges, developmental or other, with infants that develop DP, and also with any potential innovations or interventions that you use to treat and or prevent DP. How do you know, Michele, when it's time to upsize or when the baby is growing and it's time to increase the size of the device?
So, as I said, the device has several layers of foam that sit within each other like the layers of an onion. What we look for is we want the baby to be in a neutral position. The baby's head should fit comfortably inside the depression where the head goes. There should be a small gap or space around the baby's head, and the baby's head should be able to move freely. The head shouldn't be too extended or too flexed when the baby's on the PlagioCradle. If you notice the head filling the area with the baby's head completely, and that you no longer have a gap around the baby's head, or if the neck is becoming flexed, then you know you need to upsize the baby on the device and remove a layer. Once you get down to the bottom layer, when any of those things occur again, that's when you need to move the baby from the preemie size PlagioCradle to the full-term size PlagioCradle.
And in terms of upsizing, are the nurses trained to assess when it's time to do that?
So we did train all the nurses that help to care for these babies on the PlagioCradle when it would be time to change a layer. I do advise, though, if you are thinking about starting use of this device in a new setting, that you train your staff in addition to having expert clinicians available to help work with the nurses so that they have a comfort level knowing when it's best to make that transition to a new layer.
Michele, are you able to share some of your research findings with us?
Sure, I'm happy to. We actually tested the device in 80 babies in total. 62 babies completed the study. Of those 62 babies, half were randomized to the PlagioCradle and half had a traditional positioning device. What we found is that 81% of babies using the PlagioCradle went home with normal head shapes versus 54% of babies who used the traditional positioning device. Of note, though, I do want to mention that of the babies, there were 5 babies actually that had some flattening in the PlagioCradle group. But even when you looked at their head shape measures, they were very close to being normal. Overall, we saw really a dramatic difference between the outcomes of the two study groups. In addition to that, I just want to mention is that towards the end of the study, even the doctors and nurses were approaching research staff asking to use the PlagioCradle in babies who weren't participants in the study. So I think that speaks volumes in terms of the utility of this device and its effectiveness.
Definitely, great. Have you found other alternatives that mimic the PlagioCradle that can prevent or treat DP?
So there's other devices out on the market. I have not found any device that really provides the structure and support to the cranium that the PlagioCradle does. Most of the devices that have been used for many years now by NICU staff are soft and flat, and that is why we believe that they're getting the flattening and that it's not being prevented because the baby's head takes that shape. Even with something that's more fluid-like, once you put the head on it, it will tend to flatten out. The PlagioCradle actually will not flatten out. It has structure to it and support, and helps to provide normalization of cranial shape.
Were there any concerns with skin integrity, given that this is we talked about the softer positional aids not really being effective in preventing or treating DP. We always worry about, obviously, pressure and other things causing damage to the skin integrity. Were there concerns with that in the PlagioCradle?
So during the study, that was something we watched very closely. And actually, the design of the device offsets the weight of the cranium, cups the baby's head. Also, for the study, and as with all, babies and sick babies that are in the hospital, we recommend that they be routinely repositioned and that they don't stay in one position all the time. So I think with both of those things, the fact that we repositioned them regularly and the device itself was designed to offset the weight of the baby's head and distribute it evenly, we didn't see any concerns or any worries developing in terms of skin integrity during the course of the study.
How does someone obtain the PlagioCradle?
So right now the PlagioCradle is not available for people to purchase. The company that is manufacturing and distributing the device is actually looking to sublicense it to a worldwide distributor. So that's currently being explored.
What are your next steps or future areas of research related to DP?
So the next steps will be to look more closely at the issue of plagiocephaly. We know that parents are concerned when their babies have head flattening and that it can affect with bonding. It also can affect the child as they grow because of social interaction issues. Sometimes children who look different are victims of bullying. My research will be looking, though, more closely at does this have other ramifications such as developmental delays. We know that there have been some published studies that suggest that hearing and vision may be affected. So my area of research is, does plagiocephaly, is it associated with developmental problems?
We want to thank you all for listening today. We hope that this research and great work by Dr. DeGrazia has helped answer any questions about deformational plagiocephaly, the PlagioCradle, and indications for use and treatment for DP.